So I'm delighted to be here. I guess when you get to be an old fart, then you get to do these kinds of lectures where there's really no data. You just kind of stand up and pontificate about what you've learned as you've gone through your career. So what I was going to do, again, they tasked me with looking at training, primarily training. We got a lot of young folks here, so this is something actually I like to do, and hopefully, again, there's no data, but you'll be thinking, I guess, as we go through and hopefully have some questions, not only about to ask yourself, but to think about your careers. So again, I've been tasked with discussing training, research, employment, and I'll throw in one more kind of my tips for success, what I've learned throughout my brief career. So I guess we're here today, but I guess how do you define a pancreatologist? Someone who is expert, of course, in anatomy, physiology, and of course all the clinical aspects of pancreatic disease. And in short, somebody who's an expert on the pancreas. I think one thing to think about is someone who primarily focuses on endoscopy of the pancreas, like an EUS, ERCP. Is that person really a pancreatologist, or more of what I might call a scope monkey who deals a little bit with pancreatology on the clinical basis? And although people tend to go see those people about pancreas questions, really, I would submit that those people are probably less inclined to know the answer than somebody who's on boots on the ground seeing patients in clinic. But that's something I think we need to think about. Again, since we have a number of young people in the audience, do you really know what you want to be? I think we have budding, quote, pancreatologists here and people interested in that, but do you really know what you want to be when you grow up? And how do you decide those kinds of things? So what really then are your specific interests? What drew you to the pancreas? Fortune and fame? Probably might get some fame out of it. Fortune, likely not. Many of us are interested in the physiology of the pancreas. Some people like acute pancreatitis, some people like chronic pancreatitis. Again, everybody's different. That's why I guess Baskin and Robbins still exists. You know, you got strawberry, chocolate, pecan, you know, there's something for everybody. So, you know, what is it you like about the pancreas? And that's what I'd kind of pursue. And as we'll talk about shortly, there are a lot of unknowns. So I think dealing with the pancreas is kind of a very good opportunity because there's a lot of stuff to learn. If you're really interested in H. pylori, you might have a tough time because a lot of stuff's already known about H. pylori. That's not to say you can't be the leader and get fame and fortune in H. pylori, but it might be a little bit more difficult. I think the pancreas is a great area for research and clinical care. So how about training? Do we really know how to train? I don't know that we do. We typically train like we do everything else, but with a Socratic method, but is that really the best way to train? When you decide on training and where you go, who's going to be your primary mentor? And I think that's an important decision because that's probably going to influence your career because each of us have our own biases and interests. So if you go to, say, my place, for example, you might come out a little bit different than if you're at Pittsburgh or Johns Hopkins, et cetera. So you need to think about that kind of a thing. When you're training, try to interact with as many people and learn from as many people as you can. A number of our fellows kind of complain, well, you know, Mel does his scope this way and Joe Blow does his scope that way. And why does Sally do her scope this way? Well, there's a million ways to do things, so you need to develop your own eclectic approach. What do you like about this person? What do you like about that person? Try to come up with your own method of how you're going to evaluate and manage problems. And when you're training, try to interact with as many other departments as you can, surgery division, pathology, radiology. Again, this is a great time to learn and learn as much as you can and get exposure to as much as you can. And that will also be important as we talk about research. So if you want to be a pancreatologist, how long do you train? Well, I put depends because it really kind of depends on what you want to get out of it. What about the curriculum? Should you work in clinic? If so, how many clinics should you work in? I think having a radiology and pathology exposure seems to be a practical approach. Research time, I think, would be important. How much research time? Should you do endoscopy procedures, and if so, how many? I would think that most, but not all people doing pancreatology may have come from a GI fellowship, but perhaps not all, and those are going to be different people that come directly out of an internal medicine program that want to be a, quote, pancreatologist. I think it probably depends. If you come from a GI program, do you want to be a medical pancreatologist who does endoscopic procedures like EUS and ERCP? I think we could debate whether you should do that or not. And are you going to go to a place that offers the possibility of getting a research degree? I think that could be really a good thing if you're really interested in perhaps clinical research. Go to a place that offers an MPH or a MSPH. Something to think about. Should this be an RRC or a residency review committee fellowship, which is usually managed through your school and your hospital? I think this is like the typical GI fellowship, internal medicine, et cetera, but I think there's a lot of potential problems if you try to set up a pancreatology fellowship in this way. So to me, a pancreatology fellowship today is more like an IBD fellowship, where it's kind of like you find somebody you want to work with them for a year or so and do a lot of IBD stuff, and then when you come out, you don't really get a certificate. You don't have an RRC position. You just train with somebody and you graduated, if you will, from an IBD program. A little bit less formalized than GI, endocrine, et cetera, the traditional subspecialty programs. So what about research? I think doing your training, you need to do a lot of it. I think most probably in the audience are really interested in clinical care, but maybe a little bit different group. Maybe you have to be a little bit peculiar to be interested in the pancreas, number one, and maybe you're really more interested in research. So I would suggest try to do as much as you can, have as much exposure as you can, so that when you finish your fellowship, you can pursue a variety of different areas. Now, if you trained, I guess, did some clinical research, we'll go back to H. pylori, for example, in your residency program or internal medicine program. I think a lot of the things that you learn on research, you can adapt to almost anything you do. So if you learn good research methodology on X, but now you want to study Y, most of those principles would still apply. So a good research background, I think, will serve you in whatever kind of subspecialty or area you try to pursue. So what type of institution are you currently training in? Again, that will lead to the specific biases and the mentors that you work with. So if you work with somebody who's principally interested in endoscopy, you'll probably gravitate toward that type of pancreatic research, in contrast to somebody who's interested in genetics, for example. I would also take the opportunity, if it's available at your institution, to get involved with translational opportunities. Those are more likely to be funded, perhaps, but also quite interesting. So those may also be outside of the specific GI division, for example. It might be more in the basic science or something else. So really look for those kinds of opportunities. So as I got to think about this, I asked a couple of folks that had fellowship programs and got different kinds of views of how they did it, but mostly, some clinic time, some research time, maybe a little endoscopy, nothing really significant or overlapping between the people that I talked to. But I guess I would think about this really, are you going to be more of a medical pancreatologist or more of what I might call a hybrid? How about your clinics? Maybe a couple days a week, perhaps rotating with surgery at some point in time would be helpful. Spending time with a radiologist, so you're really kind of an expert on reviewing MRIs and CT scans of pancreatic disease, I think would be time well spent. Research time at least one day, again, depending on what projects you have, what you're really interested in long term. What about endoscopy time? I think most people that graduate from a GI fellowship probably want to kind of continue to dabble in it. So would you do kind of one day of endoscopy time, colonoscopy, EGD, the standard stuff, to quote, help pay for yourself. I think a lot of places do that. I think it might make some sense here because most people would hate to lose that skill and not do any of that over a whole year's time or longer. Training might need to be longer though if perhaps you want to learn EUS, for example, or ERCP in EUS specifically devoted to the pancreas. Maybe 2 years would be good, but then with those 2 years, are you going to be only doing EUS and ERCP, or are you going to be doing some research and some clinics? So I think it really becomes a little bit more dicey whether you're going to be a medical pancreatologist who dabbles in endoscopy or the other way around. I think that's kind of a difficult decision, and I'd be interested in the opinions of some of the other faculty that's here today. So what about training? So if you go to Google and you look up Pancreatic Fellowship, I think this is one of the first ones that comes up from Beth Israel Deaconess Hospital. Well, I don't know that anybody from the BI is here or involved with CAPER, not that I'm aware of, but there's a lot of other folks. So again, as I was thinking about this, I thought, hey, this would be really something that CAPER should be doing, kind of coming up with a list of fellowship programs, who the primary sponsors are, phone numbers, those kinds of things, to kind of have a list. I think I know of some places around, but I don't know all of them. So it's really kind of a word of mouth, but I think having a more organized list might make some sense. As a division director, this is me. Everybody thinks that I have money, that it just grows on trees, but that's really not the case. And then the question comes, okay, I'm going to do a pancreas fellowship for 2 years. Okay, how are you going to pay for it? I mean, money just doesn't fly off me riding my boat. You got to figure this thing out, whether you're going to do the procedures to pay for it. Unfortunately, you could do an RRC if you establish one of those, but then there are specific guidelines. Should some of the companies that are here today, should they actually sponsor a pancreas fellowship? There are some companies that actually sponsor IBD fellows, which that's something just to think about. But the money doesn't grow on trees and it doesn't fly off me. We need to figure this out. So where are the opportunities? I guess if I had my New England Journal, I thought about that. Unfortunately, when you get old, you forget things. So I forgot my New England Journal, but if you look in the back under gastroenterology, there's like only 2 jobs. And God, there are no GI jobs around. Well, there's millions of GI jobs. Nobody advertises in the New England Journal because it's $1,000 or more an ad. So that's why you don't see many positions there. But I think all of us in academics know there's tons of positions around. I think you need to decide, gosh, what am I interested in? Where do I want to go? And then get your name out there. Work with your mentor that can call people, and I'm sure there's multiple positions out there. So don't let the paucity of ads and journals really dissuade you from pursuing what you really want to do, because the jobs are out there. You may want to go to an established Pancreas Center of Excellence, and this is a publication from one of the PancreasFest a few years ago that just outlined all the components that you would need to qualify for an NPF center. So there's a lot of things here, and I think if you're going to go to Podunk, Alabama and start a NPF center, it probably ain't going to happen. So you probably, if this is the route that you want to take, you probably need to go to a larger university. But there are many universities that maybe aren't NPF centers, but it could be something good for you to go to a place and actually start one if you have all the components. This is just a map of the U.S. that has the NPF centers that you can see where those are located. Again, the vast majority are at university centers, but that's not to say there couldn't be a center in Iowa, for example. There isn't one there, but they may have all the components, just looking for somebody like yourself to start it. So what about tips for success as you're starting your career? First of all, make yourself important. How do you do that? You work hard and you make yourself important. You need to write, because publications from many places, at least at university, are the currency, if you will, for getting hired and getting promoted. But it's not the only thing. Get involved. So when somebody asks you to do something, the answer is always yes. when you're a young person, but be ahead of schedule. So you get noticed by people when they ask you to do something and you're always ahead of schedule. Your paper, your whatever it is, if you're ahead of schedule, that gets recognition. So try to do that. And also go where you're going to be successful. Well, they don't have any pancreatologist in Montana, in Butte, Montana, or whatever. Well, that sounds great to be the head of pancreatology, but you might be doomed to failure by going there. So try to think about where you're going to go, where you're going to be successful. So in conclusion, I think there are lots of opportunities out there. There's lots to do. The pancreas is an exciting organ, and lots of us enjoy it. There's lots to learn. Again, these are opportunities for each of you. And finally, lots to enjoy. When you're from Alabama, everything revolves around football, right? So in whatever position you end up, you want to be a leader of your team like Nick is, and you want to be a winner. So thank you, and I hope I've sparked a little thoughts from each of you, and hopefully we can bring this up at the discussion. Thank you.